Hello, and welcome to the PEI Lung Association's COPD virtual support group. My name is Julia Hartley, and I am the association coordinator. We know that COPD can introduce many challenges to your life, and we hope that this group will provide an opportunity for you to connect with others living with COPD, ask questions, receive expert advice, and learn skills to help you manage your condition. Although the PEI Lung Association is the host organization for this group, we really want this group to be what you want. We want to be open to feedback, so please reach out to us if you have any questions or ideas for future sessions or anything that you would like to share. You can reach us at our office. Our phone number is 892-5957 or over email, peilungassociation@gmail.com. So today's topic is preventing COPD exacerbations, otherwise known as flare-ups. We have two speakers on the call today. We have Michelle Smith with Health PEI's COPD program and Colleen Murphy with Health PEI's remote patient monitoring program. Our first speaker is Michelle Smith, who currently works in Health PEI's primary care as a registered nurse. Over the past 8 years, she has been working in the area of chronic disease, specifically supporting those living with COPD to provide education and support. She recently returned to school with goals of obtaining a master's in nursing. When she's not at work, you can find her hanging out with her two children. Our second speaker is Colleen Murphy, who is working as a registered nurse with the primary care nursing team since 2015 and is part of the RPM program since it started in 2015. Her other focus is case management, which aims to support patients to improve their health through advocacy navigation with the health and social systems. So, thank you so much for joining our session today, and we look forward to your presentations.
Thanks for having us. You'll see that we are wearing our masks and not wearing our masks depending on who's speaking. So while I'm speaking, I won't have my mask on, and while Colleen's speaking, she won't have her mask on. So bear with us. We're not professional presenters, so have patience with us. This is all kind of new, this whole virtual way of presenting, but hopefully we can provide you with some information about our COPD program, specifically to Prince Edward Island, and how COPD education program and remote patient monitoring can help assist in living your very best life. So, like the girl said, my name is Michelle Smith and Colleen Murphy is beside me, and we're going to provide the information today on this topic. So basically what to expect from us, and specifically on the COPD education program, we're just going to give you a little background of what the program is, what to expect during your visit, when to seek help, the importance of understanding and recognizing what a flare-up is, and the decision-making that may need to happen because of that. I also want to talk about the smoking cessation support program that was provincially rolled out last December, and any kind of resources that you may be able to tap into. I'll hand it over to Colleen, who will be discussing the remote patient monitoring program. We will be referring to that as RPM, and you will understand what that program is, what to expect during visits, communication to your primary care provider, and we will go over the kits, including a demonstration if we have time at the end. There are two different kits that are available, so it will be two different demos that we'll be able to present to you if time allows. So I'm just going to give you a little kind of background of what primary care is, or what a primary care network is. When we use those terms or use that phrase often, it's, I don't know what that is, I don't know what that means, but basically it is an approach that brings together different healthcare professionals. We want to make sure that you're matched up with the right professional for the right reason. We are a team, and we all work together back and forth to provide you with the best care at that moment in time. The network teams, we're partners to support your health. We communicate with each other. And as I said, we are teams of professionals. So you'll see your physician, your NP, your registered nurse, your LPN, your dietitian, your social worker, whatever it is that you may need, you may have access to it within the primary care networks. So basically, wherever you are on the island, you do have access to primary care networks. You'll see here on the screen that there is a map. The map is color-coded. It's color-coded so that we see those individual invisible dividers of our networks. Basically, what you need to know is wherever you geographically fall on the map, you will have access to a primary care network. Typically, we follow those persons whose primary care provider, their doctor, their NP is within our catchment area, within our 30-kilometer our borders. However, wherever you are located in your home, if you reach out to one of the networks, we will guide you to where you need to go, the very best place. What you need to know about this is that the COPD program is available to you provincially, wherever you live on the island. This slide here, although it's a little bit busy, it just outlines all the different opportunities for you to connect with our networks. If you're familiar and comfortable with using Google and just doing a quick primary care network search, you will come up to a government web page that will identify where these networks, where these facilities are and how to contact those facilities. Basically, our goals of care within the COPD program are to reach those individuals who have been diagnosed with COPD as early as possible. Ideally, we would like to see those in the mild stage of COPD. However, we see all ranges. Our goals include providing information about COPD, strategies for self-management. We want to provide you with the information to guide you in supporting lifestyle changes. If you're ready for those, we want to guide you through those. We review medications, which includes how do you deliver your puffer? Are you correctly delivering your puffer to yourself every day? So each appointment, you bring your medication and we'll go over that piece. We're going to look at your vaccination status. Are you or do you need to update this piece? Do we need to collaborate with public health? And then we are going to book you for follow-up appointments. It is different for everybody based on what your needs are and how frequent those appointments will be made. But certainly there is opportunity for follow-up as frequently as you need it. So as I'm sure you guys are already aware, this is just a slide about what COPD is. I'm not going to go into too much detail. I know that it's already been presented on. Basically, this chronic obstructive pulmonary disease affects your airways. It does get progressive over time, and unfortunately, there is no cure. Our goals are really to provide you with the knowledge, the education, and the know-how to slow this progression down. We know that with proper COPD management and lifestyle modifications, you can enjoy a more comfortable quality of life. So connecting the dots, who are we and what do we do? Whether you've been diagnosed with COPD for years or recently diagnosed, you can reach out to us and get enrolled into our program. Your physician, your NP may reach out to us and enroll you in an official referral process. You may be enrolled because you've been presented to the hospital for a test and somebody's identified that you have COPD and think this might be a good program for you. So basically, our referral sources do come from many different options, and you can make that referral yourself. Again, if you reach out to the primary care networks, a primary care network, we can help you navigate through that piece. And basically what's important is we want you to know as much about your COPD as possible so that we can help manage your symptoms and help prevent these flare-ups or these exacerbations. Basically, at the initial appointment with the registered nurse, we are all registered nurses that provide you with your COPD education. We all have had advanced training in COPD support to be able to understand and give you the most up-to-date information based on what the current guidelines and recommendations are. You'll present to your appointment. It's typically about a 1-hour appointment. A physical assessment will be completed. The nurse will review your symptoms. We'll discuss COPD goals at the clinic visits. We'll do a breathing assessment. As I said previously, we'll review your puffers. We want to optimize delivery. COPD education and resources will be provided. Spirometry testing or a breathing test may be completed as needed, referrals to other professionals as needed, and finally, an information letter is sent back to your primary care provider. That's important for a few different reasons. One, we want them to know that, yes, you presented to us, this is what our findings are, and we may need their support for treatment options going forward to, again, optimize that care. We want you to feel good. Our long-term strategies for you are really to prevent and slow down your disease progression. We do assess and we treat all individuals diagnosed with COPD. That sometimes waxes and wanes. Sometimes people start the program, they've had adequate information, they choose to exit the program, but you're always welcome back. Our goals also include alleviating breathlessness and other symptoms. We want to provide you with the education that you know how to get relief from this breathlessness that you may be experiencing. Our goals are to assist you in improving exercise tolerance and increasing your daily activities, reducing frequency and severity of your flare-ups or exacerbations, and improve your overall health status. Ultimately, let's reduce the death. So what makes my breathing worse, and what do I need to do to get help if my breathing worsens? You probably all are aware that our triggers are unique to each individual, and knowing your triggers can help you improve your COPD management. Some triggers can be avoided, while others are minimized with careful planning. The COPD triggers are things that can irritate your lungs and make your COPD symptoms worse. So we're looking at some things like cleaners and perfumes. Nowadays, everybody is sanitizing. Those hand sanitizers can be very odorous. It can cause that trigger to happen. The cleaning products in our home, we're all trying to make our home as clean as possible. They can be very irritating to individuals' lungs, and it may need an opportunity to make changes in that area. Stress and emotion can play a big part in our breathlessness. And within each appointment, we'll talk about that, talk about where your stress is, talk about what your emotions are, and strategies that can help alleviate that breathlessness. Weather changes can have a big effect on our breathing, on these triggers. For instance, when the weather's freezing cold, maybe we'll have that trigger. A breathlessness response happens, and we'll talk about ways that you can overcome that. Same with humidity, air pollution, and finally, secondhand smoke, which is included in that. So here's some tips to avoid triggers: reducing your indoor air pollution, avoiding outdoor air pollution, if at all possible and you're ready, quitting smoking and avoiding that secondhand smoke, reducing your exposure to strong fumes, wearing a scarf over your mouth and nose in the strong winds. We're all wearing masks these days. Relaxing in a clean, cool place during those hot, humid days. Lower your expectations. You don't need to do the 5 errands that you had on your day if the day is hot and humid. Take a break and enjoy the cool environment in your own home. Keeping a healthy distance from sick people and staying up to date on your vaccinations. Again, each appointment, we're going to walk through this. We're going to discuss this. We're going to support you through identifying and understanding what your triggers are. So we know that flare-ups are a serious health problem. They're a leading cause of hospital visits, and they're very disabling to the COPD person. So it's really important for you to know the signs, and that's essential for your health and well-being while you live with COPD. So warning signs of COPD flare-up include new symptoms, new COPD symptoms. I wasn't breathless, and now I am breathless. Or my symptoms are getting worse. What I was coughing up was clear, and now it's colored. You can prevent flare-ups by avoiding your triggers and understanding what that looks like, what that symptoms change looks like. So specifically, again, you're going to see changes in your mucus or phlegm, unusual or increased breathlessness, symptoms of a cold, unexplained tiredness or fever, chest tightness, unexplained swelling. Maybe you're needing more pillows to sleep. Maybe you're talking about morning headaches, difficulty sleeping, restlessness, confusion, blue lips or fingers. These are late signs that you need to reach out for some extra support and help, and maybe present to the emergency room if needed. So who are you going to contact? What do you do when you're not well, when you're feeling unwell? Well, you've got your COPD educator that you can reach out to. You have your physician or your nurse practitioner that you can reach out to. Give them a heads up. Hey, I've connected with my COPD educator. This is what our plan is. I need a follow-up appointment. You can connect with your RPM nurse. Colleen's going to talk about what the program means to you and how do you reach out? How do you identify that you're having an issue or concern, your symptoms have changed? You're going to want to include those people closest to you in your world to understand what they need to be mindful of. How do they support you when you're not feeling so well? One thing that helps to support you staying well and is part of COPD management, part of our guidelines, part of our recommendations include a COPD action plan. So I don't know if you can see this is our COPD action plan. You may or may not be familiar with this. Certainly if you've been to pulmonary rehab, you would absolutely be familiar with this. If you come to the COPD program, we will talk about this. And if you enter in the remote patient monitoring, we will talk about what this means. This is your roadmap. This is your guide to living well. If you can imagine a stoplight, a traffic stoplight, when things are green, when things are going well, you're going to continue on your merry way. Things are great. You're going to continue your usual plan. However, when things change, that's when you pause and question what's going on and do I need additional help? And finally, as things deteriorate, this is going to tell you what to do and seeking that emergency care if you need it. It also has the opportunity to have a prescription section here so that you can activate this action plan. If you've identified that you have a flare-up, you can present to the pharmacy and ask them to start your action plan. This is something that we need to have your primary care provider support us with. And this is something that we would include in our letter. So we would recommend an action plan for their consideration, and they may write antibiotics and prednisone or medication of their choice in the event that you have a flare-up or an exacerbation of your COPD. Basically, throughout these appointments with your COPD educator, we're going to help you recognize what those flare-ups are and maybe what other changes you need to be mindful of. We're going to personalize your roadmap to help you manage your COPD. It is individual. Not everybody has the same roadmap. We're all very different, and we need to be able to support you in your differences and your level of wellness. You need to keep this handy, keep it on the fridge, have your support people know where this is. And just so you know, like any prescription, this needs to be renewed every year. So it's helpful if you are able to bring this to your COPD educator. So she has a copy of it, that person has a copy of it. We can talk about this. We can talk about your understanding and how to work through this action plan. We want you to refer to this often. This is what's going to help support you in staying well. It's going to have our contact number, and other support people's contact number are in the event that you need to reach out to somebody. So next, I'm going to move on to smoking cessation. So for those individuals who have continued to use those tobacco products, we're really going to work with you to support you in making changes. We know that the effects of quitting smoking start within hours. So you stop smoking, there's changes that happen at a body level that we can start to notice. Within 72 hours, your breathing becomes easier. Your tubes are becoming relaxed. And within 2 weeks to 3 months, your lung function is actually going to increase. So basically, the single most important thing that you can do to slow down the progression of your COPD is quitting smoking, and we can help you with that. So this slide is just identifying the importance of, it doesn't matter where you are in your trajectory of your illness, wherever you stop smoking, we're going to see those improvements to your breathing. So what is the PEI Smoking Cessation Program? The smoking program, the PEI Smoking Cessation Program, helps PEI residents who wish to stop smoking or using tobacco products by covering 100% of the cost of nicotine replacement therapy products, such as nicotine gum, lozenges, patches, and inhalers. And perhaps if your request is for certain prescription medications, we can help with that. To be aware, it's once per year that you are eligible to enroll in this program. So if you were enroll in the program today, today's the 24th of March, and 6 months later you have had a little slip and you start smoking again, when March 24th, 2022 comes around again, you are eligible to re-sign back into the program. So it's not a one-time only. You can re-enter once that year is up. So you might wonder, well, how do I make an appointment? First of all, as I've kind of echoed throughout, you need to contact your primary care network. You need to contact those individuals who are providing the services. So it's the registered nurses here within the primary care network that do that service. To make an appointment, you contact our clinic, and you're going to discuss your readiness to quit. The nurse is going to discuss the supports that are available to you. They'll go over an intake form, and they'll ask you questions about your readiness to quit and your tobacco use. These appointments are done over the telephone. You don't have to come into our clinic to have access to this program. Everything can be done over the telephone. The intake lays out your cessation plan. So what does it mean for you, and how are you going to find success with quitting smoking? Recommendations for treatment options will be provided to you, and you'll be given information and booklets for your review when you're at home. They'll talk about your past medical history and your past quit attempts, and the nurse might suggest to you certain products or prescription medications. The nurse will review the guidelines of the smoking cessation program with you and ask you confirmation and consent to send this information to your pharmacy so that you're able to access your product. So again, to make an appointment for smoking cessation, you need to call up the primary care network, a primary care network in your area. So finally, in my part, and then I'm going to hand it over to Colleen, we want you to be success. Really, that is our goal, is for you to find success, whatever success means to you. For us to do that, we need to be updated on the guidelines and pathways. And we're going to use that information, that up-to-date information, to give you the most accurate information and recommendations. We're going to support you through lifestyle modification. So we're going to meet you where you're at. What changes would you like to make? We're going to support and encourage change. We're going to establish goals. And again, we're going to recognize where your readiness is in relation to change. So that's it for our COPD program. I'll pass it to Colleen, who will now discuss remote patient monitoring. And then if you've got any questions for me, I will be here at the end.
So hello, everyone. So my name is Colleen Murphy, as we mentioned in the bio there. And I'm going to talk to you about the program that I'm involved with, which is Remote Patient Monitoring Program. And then I'm going to demonstrate, we have two different styles of equipment here, and I'll demonstrate both of those. So it's a 12-week home-based program, so you do it out of your home. And the primary goal is just for support and assistance to help you self-manage with your COPD. We also do this program for people with heart failure, but specifically today we're talking about COPD. So with self-management, we're trying to get people to understand their own reaction when they're having a flare-up. So your body and taking responsibility for when you're not well. A lot of people sometimes know they're not well, but they don't really want to deal with it that day. Like, maybe I'll go to the doctor tomorrow, or I'll leave it till Monday. And then sometimes that is the reason why you end up in hospital. And I recently had a gentleman on our program who was in that exact situation, and he had a pneumonia, and he actually went septic, and he ended up in ICU. So we're trying to get people to recognize when things need attention. And that's not always easy. So therefore we're trying to help you understand normal symptoms and changes to symptoms. When you're having worsening shortness of breath, to pay attention to that. We talk about an action plan, as Michelle already talked about. We talk about vaccines and whether or not you're up to date. And most people, by and large, are getting the flu shot for sure. And many people are getting the pneumonia vaccine. There's only been a couple of people that have not wanted to entertain the idea of any vaccines, but it is one of the recommendations that we do follow, and it's incumbent upon us to mention it to you. Avoiding triggers, the humidity, the cold weather, being around sick people, even diesel fumes, perfumes. There's lots of triggers, and some people have, ones that aren't that common. So trying to pay attention to that. Following up, making those appointments with your primary care provider, which when I say that, I mostly mean either your physician, your doctor, or your nurse practitioner. So maybe you had an action plan and maybe you used it. But I mean, you probably should be touching base with your primary care provider after that. Just because you have the action plan doesn't mean you don't need to see your care provider. And yes, just using whatever resources and supports are available. So some of the information in the package that we provide, we use the Living Well with COPD booklet, and you can register with them and you can create an account, and there's all kinds of patient information. And same with the PEI Lung Association, right? There's lots of information out there. So we do promote the ones, you can Google anything, but you're not necessarily coming across accurate information, but we follow standard Canadian or maybe global guidelines. So the information we pass on to you is what we would consider applicable and safe. So when you are coming to pick up equipment, being on the program requires 2 appointments. The rest of the time you're in your own home. So the first appointment, you're picking up the equipment, and the second appointment, you're dropping it off. So during that appointment, there's me and another nurse that do it here in Charlottetown. So we will show you the equipment, what it looks like, and how to set it up, and then how to take your own vital signs. So when you go home with your equipment, you set it up, and then every morning, Monday to Friday, you do your vitals, and that session involves answering a couple of questions. generally around 3 questions, and you answer yes or no. So there'll be questions: are you more short of breath today? Do you have any changes to your sputum? Those types of questions that'll help us try and identify that there might be something going on with you. So you can reach out to us, or if we see that when we're looking at your particular numbers and your answers, we will call you and try and get more information from you as to how you're feeling. Sometimes people just push the wrong button. Oh, I meant to say no and I said yes. And you can't go back and change it. So, or people say, well, yeah, I was kind of feeling like that this morning, but I think I'm okay now, you know. So we just have that conversation and try and determine, is there something going on? And, you know, what's the plan going to be? You know, do you have an action plan? Is it time to launch the action plan? Are you going to try and get into your doctor? Or you know, or should you be maybe heading off to emerge? You know, but we're trying to catch you before you're in that state. But with some people, things progress very rapidly. I mean, I've had a handful of patients, and you know, they're fine one day, and the next day it just starts very quickly. So it's not always possible to avoid the emerge visit. So let me see. So at your appointment, it could be, we have a couple of LPNs in some of the networks that give the kit out to you to show you the demonstration that. But the follow-up over the phone is with myself or my coworker. So we are nurses, and we've had the course, the COPD specialized course as well. So the program works by, you send your vitals in between 8 and 12 o'clock. We only run this particular program Monday to Friday, 8 to 12. So we ask people to send their vitals in before 12 o'clock. And that comes to our computers, and we just follow up. We don't call every day. We call when we think there might be something going on. So, I mean, you could be, you know, weeks without hearing from us, but you're always free to call us if you're concerned about anything. Yeah, so then we would just create a plan. Like I said, if there's something developing, and we would try and decide together what we think the next best step is for you. So we do have some criteria as to who can be on the program. So the main thing is you have to have a diagnosis of COPD. Or of course the heart failure people have to have that diagnosis. So a diagnosis comes following your pulmonary function test or spirometry test that you will have had, and then of course somebody will have told you, yes, you do have COPD. So if you know that you've met that criteria, you are free to self-enroll, self-refer, I should say. And otherwise, we get referrals as well from the hospitalists, and we have a COPD coordinator, and she may refer to us. My coworkers will sometimes refer. They will say, I have a woman on the COPD program, and she, I think, would be a really good candidate for our PM, and that will be a referral that way, or nurse practitioner or your doctor. So there's many ways, and again, you can self-refer. The number on the screen, that's the main line. So that'll be one of our admin that will answer that, and you just talk about the program, and she will pass it on to one of us. So the program is 12 weeks in length, and it's Monday to Friday. A lot of people send in on the weekend too. If you're the kind of person who would like to do the exact same thing every morning, you're free to do that. We're not in the office on the weekend, and we're not there on holidays. So no one's going to respond to what you send, but you're free to do it if you would like, because some people just like the same repetition. And it's a little helpful, like if you come on a Monday and somebody looks not well at all, and you look back on their Saturday and their Sunday and you say, oh yeah, this is 3 days running now, you know. So it's somewhat helpful. And I mean, if you had the program and you were not engaged with it, or you didn't think it was doing anything for you, you know, you're not tied to the 12 weeks. You could call and say, you know, I would like to end the program early, and we would accommodate that. I mean, it's no point in being on if you're not seeing the benefit yourself. But I have to say we have a very positive response to the program. It gives people a good sense of security, knowing that they can just pick up the phone and somebody's on the other end that's familiar with their situation. A lot of like older people who live alone, their family is really, they just have so much confidence in it because they know somebody's there on the other end of the phone for their loved one. So we do have a very positive response to the program. So when you come for your appointment, it's about 45 minutes long. I've certainly had longer and I've had briefer. I do ask you to bring a list of your medications, and we go over what you think you're supposed to be on and what I think you're supposed to be on based on, maybe a hospital record or whatever last record I would be able to have. And we just make sure that a lot of times when you're in hospital, they'll change a couple of medications. And they usually print off a discharge summary for you. But sometimes, if you've been in hospital and been sick and you're going home, there's a lot of preparation trying to get physically out and into the house, and somebody's picking you up. There's a lot of stuff to know and remember and hear. So you might not have gotten your discharge instructions. So it's good for us to go over that. It's good to bring a support person. It just depends on your comfort. I mean, it is technology, so some people are, 2 sets of eyes and ears are going to be better for them. So we certainly can accommodate that. If you're someone who's quite familiar with, an iPad or smart tablet or anything, you probably mightn't feel that way, but you're certainly welcome to bring a support person. And sometimes there's people who aren't well enough really to come out for the appointment. And it might be a son or a daughter that come and get the kit, and they get all the information, and then they take the kit home and set it up. And then the person is the one, that I'm getting the information from, but the person doesn't necessarily have to be the one coming if they're unwell. And we've certainly had that situation. There's a couple of forms that you have to sign. So one is we call it a loan agreement, and it just talks about the fact that you're borrowing this equipment from Health PEI, and just how long you're borrowing it for. I sign it, you sign it. There's a waiver on the bottom about having proper electricity in your home, proper grounded electricity. So it's just a safety thing. But, I always say if your nephew wired your house, maybe we better make sure that you have proper electricity. So anyway, then the other form is a consent to be on the program. So it just talks about the fact that you're on the program. It's only going to be your vital signs that I'm getting. Your husband's not going to take his vitals, and I'm not going to get his, because this is your medical record. So it talks about not being on the internet. And if there's any damage to the equipment, just to notify us. And that kind of thing. So there's just a couple of forms to sign, and we also get you to do the CAT questionnaire, which most of you, I'm sure, have had several times. It's an 8 question on how COPD is affecting you, your functional status with it. And we do that at the beginning, and then we do it again at the end. And quite often the score is improved, which is what we want. So we do some communication with your primary care provider as well. We always send a letter about a week in saying your patient is now on the program, and here's the first week of vital signs. We print off a record and we fax it over with our letter, and so they can see what your vital signs are. And if you answered yes to the questions about, a cough, they would see that. At the end of the program, we do the same thing. Your patient has now completed the program, and here's the last week of vitals. If there's something in between that needs attention, we would send a letter also at that time. We're not monitoring people's blood pressure per se, but we often notice that some people have very high or maybe very low blood pressure. So if that was the case, we would be drawing attention to that in a communication to your physician. And we would also say to you, I think you better follow up with your doctor. So, sometimes people have high blood pressure and they don't know they have high blood pressure. They might have never had an issue with it. So, and, it's more specifically, if you were having symptoms of a flare-up, and we felt there was time enough that maybe you were going to try and get an appointment, it might be that I might fax off something, and that would support you getting an appointment sometimes, right? So we're working together, the three of us, your healthcare provider, myself, and you, to create a plan, and whatever communication is needed to make that happen, we are trying to support that. So we already mentioned that there are two types of kits. So there's one, it's called a DM, and it's everything is kind of hardwired into that kit. So the blood pressure is physically connected to it. So is the oximeter, which is the one that takes your oxygen level on your finger, and a scale. And it's plugged into the wall, and you do your vital signs, and it does transmit to the computer. The other style is called the tablet style, and it's like a smart tablet, and the components are Bluetooth connected. So that's how the information goes from your blood pressure machine and your oximeter to the tablet, and then from the tablet it comes to our computer. So two different styles, and we try and figure out what would be suitable for which person. And sometimes we don't have both styles available, so it just kind of depends. Yes, and there's no cost for the program to the patient. Any kind of data charges and whatnot that are incurred with this are not your responsibility. So I guess if we have time, I will do a demonstration of the tablet first. So can you guys see the tablet? You can't see it yet. Okay, so I'm going to unplug it. That's the tablet there. So you would touch the Vitals Now button, and it will ask you what you want to do. Do you want the questions or the blood oxygen, the blood pressure, or the weight? I want you to do all of it. So I want you to hit select all, and then you have to just hit next. And after this, the voice will tell you everything.
Do you want to send your vitals to your clinician?
And you would say yes.
No questions to ask at this time.
But there would be questions. I'll have them programmed.
Please put the oximeter on your middle finger and then turn it on.
Okay, so I will continue on. I guess you guys can see the screen. So it said to put the oximeter on my finger. So I open it, it's like a clothespin, and I open it on one end, and I put my finger in, and then you turn it on. So we'll get a reading here. So I already have a reading, but it hasn't populated to the screen yet. It's gonna wait, because sometimes you need a minute or so before your blood oxygen level will capture.
Please remove the oximeter from your finger.
Okay, so now it's gone to the tablet. So my heart rate was 90 and my oxygen was 97.
Press the start button on the device when ready.
So now I put the blood pressure cuff on. And we go over, the proper placement of everything with you. There's all kinds of tips when you're taking your blood pressure. And then she said, press the start key when ready. So I'm ready now, so I'll press the start key. Time-wise for not much for questions.
Please remove the blood pressure cuff.
So my blood pressure read on the machine, and it translated to the tablet. And now it'll ask for the weight. And I will not be stepping on the scale. We'll be putting a hand on the scale. But if you just listen to her prompts,
Please step on the scale and stand still.
she tells you everything.
Please step off the scale.
So there's a recap of all my vitals, and
Please remember to take
It'll-
your medications as prescribed by
It'll
your
come back.
physician and maintain the proper diet. Thank you for completing your vital signs measurements.
So it stays on the screen for a few minutes, and then we provide you with a booklet where you write everything down. So for the whole 12 weeks, you're supposed to write down your vital signs every day. So it sits there for a few minutes, and it says here transmission successful. When you see that, you know it's gone to my computer. So that's the end of your session then. So I think time-wise, we don't have enough time to do the other style, but I mean, I can show it to you. It's very similar, only the technology is different. It's this black box, and everything is hardwired into the back of it. But it would work the same. You would press a button, and the voice would tell you what to do, and you would do it. The numbers would appear, and then they'll stay afterwards and give you time to write it down. So it's as similar, but it's just a little more, everything's hardwired into the back instead of Bluetooth, basically, would be the difference. So I think with the time, we better wrap up our part. So there may be time for questions then.